Today I'm going to show you how to hook up a Ranger warming system for some IV fluids. And let's just say your patient comes back from pre-op and they have their primary IV set already hooked up to their IV with stopcocks, ports, and extension tubing already and done. What you want to do is grab your Ranger cassette insert and pull it out of the package. Now you'll notice that there are two sides to the cassette. One side has writing, the other side does not. Insert the cassette to where the writing is facing upward. Insert fully. Once you have the cassette, you want to go ahead and hook up your primary set to the blue side. The blue side is showing cold fluids. The red side, hence the cap, would indicate that it's warm fluids. So the blue side is going to be the portion that's hooked up to your primary set. Before you disconnect your primary set from the patient, however, you want to make sure that your roller clamp is off and that you have turned off the fluids going to the patient. That way no blood or fluids back up from the patient. Disconnect from your stopcock. And then you want to hook up your primary to the blue port. Now you can see that the primary is hooked up to the cold side of the Ranger. Go ahead and turn on the Ranger fluid warmer. And now what you want to do is you want to prime the cassette to flush out all of the air. In order to do that, just go ahead and turn on your primary set, and you'll see by the drip chamber that fluid is now running. Now there's a secondary drip chamber on this Ranger cassette. Hold it inverted. That way all the air is pushed up and out. Once that chamber is completely full of fluids, go ahead and clamp off the warm side of the Ranger cassette and then place that drip chamber into the little holder off to the side. That way, if any air bubbles are created during the warming process, they will stay in the drip chamber. Go ahead and take off your red cap and flush all the way the rest of the line and hook up. Turn on to the patient, and now you are providing warm IV fluids to your patient. Now, when you're finally done with the case, and you want to transport the patient over to PACU, you don't want to take the whole Ranger warmer with you. So now we have to take this cassette out without it draining all over the floor. As you fill up the cassette with fluid, it expands on the inside to where you cannot pull this cassette out. So we have to take some of the fluid out in order to pull the cassette out to be tossed away. Now the way to go about doing this is go ahead and turn off your primary and then turn off and clamp the tubing on the cold side. What this does is it prevents any more fluid from entering the cassette. Next, what you want to do is just take a 10 cc syringe and clamp off towards the patient. Open a side valve. And then what you'll do is you will then retract some of the fluid out of the cassette. And what this does is this pulls the fluid out of the cassette, thereby shrinking it in size. Usually 10 cc's of volume is sufficient. Once you have pulled off the fluid, then you can go ahead and pull the cassette out. And then making sure that your extension tubing is clamped off, you can then disconnect and then reconnect to your primary set, and then toss the cassette away and then take the patient over to PACU. So with this Ranger cassette system, it is recommended that you have extension tubing in between the warmer and the patient. The reason why is because the tubing coming off of the Ranger cassette is not very long. And so you can see how limited you can be so far as the movement of the patient and how close the Ranger warmer has to be.